Hello, I'm Norbert Gleicher, MD, and I'm the Medical Director and Chief Scientist here at the Center for Human Reproduction. The topic today is Mini-IVF, and actually, why should we skip Mini-IVF? And the answer is simple. Mini-IVF is really almost an artificial concept. And allow me to make the point as an old-timer who has been around IVF from the very early days. And what many people don't know and what many patients are not being told is that IVF actually started as so-called mini-IVF, because in the early days of IVF, we either used natural cycles or we used a medication called Clomid, which is an oral fertility drug. And that's how IVF started. But IVF became a successful infertility treatment only after colleagues passed on to stronger stimulation of ovaries. And that came with the introduction of gonadotropins into IVF stimulations. Only once that happened, a few years after the first few IVF babies were born, suddenly pregnancy rates jumped up and IVF became a viable infertility treatment, indeed probably the most important infertility treatment nowadays. It therefore is a little bit paradoxical that some of our colleagues propose to go back to what hasn't worked. And it is paradoxical because, after all, what every infertility patient values more than anything else is to get pregnant. That's why patients come to fertility centers like ours. Their primary goal is to get pregnant. And therefore, we here at the Center for Human Reproduction still see this as our primary goal, or as the effort that is most important. Now, obviously, all of this needs to be done with a proper safety margin, but all the concerns about so-called hyperstimulation leading to ovarian hyperstimulation syndrome, which has been one of several arguments why mild stimulation in mini-IVF is preferential. All of this is really outdated. With modern infertility practice and reasonable clinical competence by the physicians who treat, severe ovarian hyperstimulation is really a thing of the past. You almost do not see it. And therefore, what's left is the pregnancy rate, the chance to get pregnant and to have a healthy delivery. And there is not a single study in the medical literature that has not shown that the pregnancy and live birth chances from mini-IVFs are significantly lower than from normal or average normal stimulation. So, just on that basis, we are not big fans of mini-stimulation. There's also the argument that it is cheaper. It's cheaper because the cycles are less involved and therefore the charges are lower. Less medication is needed, and therefore medication costs, which can be significant in an IVF cycle, are lower. But even that is really misinformation, because in the end, the question is not what is the cost per cycle, but in the end, the question is what is the cost per healthy baby born? And here we come back to what's the most important thing, pregnancy and live birth. And if that is so much lower with mini-IVF cycles than with regularly stimulated cycles, then even financially the argument that mini-IVF is cheaper is really incorrect information. So who is a candidate for a mini-IVF cycle? Actually, very few people. And at least at the Center for Human Reproduction here in New York City, we believe that mini-IVF can be a good option for a young woman with very good ovarian reserve who, even with very mild stimulation, still produces a good number of eggs and embryos. In those cases, absolute yes. But that is probably, overall speaking, 15% or less of the total infertility population that fertility centers in general see. So be careful. Mini-IVF is not good treatment. Mini-IVF reduces your pregnancy chances. And in the end, it will cost you more, not only in terms of money, but what is even more important for many infertility patients, in terms of time. How quickly you get pregnant is important, especially if you're an older patient, where time is never on our side. I hope I have helped in understanding the concept of mini-IVF. Thanks for listening.